So Eric, thank you so much for doing the recommendations. And we talked a lot about social distancing, and that's relatively new from last week. And there are a lot of people right now who are isolated in their homes, and we recognize that that has a huge impact on mental health. And so we've invited an expert, Dr. Leslie Graf, who's a PhD psychologist. She's a professor and head of the Department of Clinical Health Psychology at the University of Manitoba. And Leslie, we just wanted to spend a few minutes talking to you a little bit about the recommendations that Eric's made around social distancing, around isolation, and with these increasing requirements and the realization we may need to live this way for some time, what will the psychological impact be, and what can we do to adjust to this change?
Yeah, those are really good points to bring up, and things. It's really timely now to be looking at what we can do, because social distancing, which most of us wouldn't have thought about or even know what it really meant, wasn't on our radar, and now it's actually our new reality. And as you said, it looks like it's going to be some time that we're going to be in this. Both of you have given information that's kind of concerning, of course, the rapid spread, but in there is also a really important point, which is we have steps we can do individually and collectively, which are going to help. And the social distancing is a key part of it. So it's just broadly, I think that one little reassurance that people can take, our IBD patients can take as reassuring, is that it's not just you who have to try and make changes or do something different, but it's actually all of us collectively are now being asked to work together to protect each other. So I think that's one reassuring piece. However, the reality of what we're all of a sudden in is something that I think most of us wouldn't have experience with before. Our children are not going to school. We shouldn't be out and about doing our regular things. There's not hockey games to go to. There's many needing to go to work, but still many who have to be home. And it will be difficult. This is something new and different. Even if you really love your family, you're going to be in close quarters with them for quite some time. And so we are all going to have to learn how we can do our day-to-day differently. As people, we're really built to connect with each other. And in times that are scary or hard or something difficult has happened, we naturally want to gravitate to each other, gather, hug, share. And we won't be able to do it in the same way that we have, normally have been able to. So all of that is just trying to frame what the struggles will be. But I think going forward, if we start to think about specifically what this can look like, first of all, as you move into, if you haven't already moved into that social isolation or social distancing, moving into that now means you are part of the solution and you are saving lives by doing that. When it gets into the day-to-day, though, what does that mean? Because in the day-to-day, it's hard. It's long days. You may not be talking with people as much or so on. So as much as physical distancing and social distancing is now happening, we want to think about how to counterbalance that with psychological closeness. So really intentionally thinking about how can I make sure I'm connecting with other people. It might be there's already people in your home, and so you can certainly do more of things we might have fallen away. Where are the puzzles? Where are the books? Where are the games where we can kind of connect together in the household? But many people, we have lots of loved ones and others we'd like to connect with that are not in the house. They're not in the same community, they're not in the same province, and we know it's going to be some time before we can see them again. So thinking about how do I intentionally connect? We actually are in a period where we have so many options of ways we can connect. It used to be, you mail a letter, but now, of course, we can text and Skype and FaceTime and many other things. What I would encourage, though, is those are still distant. If you email someone, texting sure is closer, but not as personal. I would really encourage that you do more phone connecting and more of this type of connecting where you can see the other person, and in fact get creative about it. If you have family down the street or in another province but you can't see them, if you can link in through something that like Skype or FaceTime that connects you like this, connect at dinner time and sit down together for dinner in a bit of a virtual way. We haven't really thought about that before, I think, but these will be the times to really find ways, as I said, to intentionally build that psychological closeness. The other aspects to think about are just day to day when you are at home. How are you going to get through that day? The first week you might be tempted to just sit around your pajamas and catch up on all the Netflix or whatever you hadn't had a chance to. But this looks like it's not going to be counted in days or weeks, but probably months. And so starting to build in a structure and routine. Many people may be working from home. Get up, get dressed, go into your home office and focus as if you're at work. Or otherwise build that routine with whether it's with kids at home or with yourself. Equally important is build in exercise. What are all the things that are going to help us to keep well over this time? The basics are still going to be super important here because part of it is we're aiming to stay as healthy as we can to protect if we do run into that virus. So what can you do in your place if it's harder or if our social distancing requirements progress further? Start looking at the space you have and what types of exercises you can do. Look at what you can link into because it's kind of more fun to have, link in with, I don't know, the yoga instructor or the exercise video or something to be able to be active there as well. So think about psychological closeness and how you can build that in. Really connect with the people that you are with in your household and look at ways that you can enjoy the time with each other and keep up those important aspects of routine and structure, exercise, and so on. So those would be some key points I would want to hit on.